Next is Social Democrats Deputy Roisin Shortall has 6.5 minutes.
Thanks, Cathaoirleach. Minister, just wanted to pose a few questions to you quickly and hopefully get the responses then. I just want to agree with the points made by earlier speakers about the need for transparency. And that's really important. All of this information in relation to, the numbers of vaccines that are delivered here, the numbers that are available, the number you're holding back, and the number that are administered, that should all be public information. And like everybody understands that the supply is volatile, and the more open you are about that, the better. So the people understand then what the situation is. So we had to wait till the last few days till we got a PQ reply to Catherine Murphy to find out how many had actually been delivered up to the end of February. Like, we should have that information on a daily basis. You've said weekly, every week you've come in here, I've asked you to make that information available. And I'm asking you yet again, will you just put it out on a daily basis with the daily figures for the vaccines? And everybody would know where we stand. We would also then be in a position to actually consider or assess the performance of the programme. And that's something that we should all be entitled to do. So data is essential for that. On that basis then, Minister, just an interesting and concerning figure has emerged. We know that over 40,000 Moderna doses have been delivered. And yet, up to the end of February, only 9,300 of those were actually administered. And I'm just wondering, do you know what the explanation is for that? Why is it that we're not using all of the Moderna and only a quarter of the Moderna? Okay, so in relation to Moderna, you've said that up to the end of February, 40,200 have been delivered to this country. And yet, for the end of February 28th, only 9,300 were actually administered. So I don't know if you have an answer today, but if you can provide it to me as soon as possible. It's puzzling why that's the case. My next question then relates to what's going to happen from the time that we get large quantities in. And we know that 1.2 to 1.3 million doses should be coming in each of the months, April, May, June. Now, we're currently administering 12,500, on average 12,500 doses per day. If that number of vaccines come 1.2 to 1.3 million from April, we need to ramp that up to about 40,000 vaccines per day. Now, that is a huge step up, and that's due to happen in only 4 weeks' time. So what I would like to know, and I'm sure others want to know, is what centres are going to be used and who will the staff be? And are they ready to roll as soon as we get into April? So are you going to publish a plan for the centres to be used and the staff so that we are in that position from the 1st of April? My next question relates to representations we've received from the Irish Cancer Society. Now, this is in relation to the reordering of the priority groups. But within that reordering, people under 64 and under, who are at high risk of severe disease, their position hasn't changed. They're remaining at category 7. Now, the Irish Cancer Society is concerned that, specifically about people with haematological cancer, who haven't been brought up to level 4. Or category 4, and they're saying that for those people, there's a comparable risk of death for those patients. And I'd just like you to clarify that, and if you could send me a note on it, I'd appreciate it. My next point is just in relation to messaging. And about 3 weeks ago, you said we were starting the vaccinations of over 70s, and you referred to that programme again today. Now, when you say we're going to start the over 70s, people who are over 70 expect that they're going to be getting it shortly. But there are, sub-categories within that. And I think it would be much more helpful if you said, we're starting the over 85s or we're starting the over 80s and just break it down, because it's going to be some time before people between 70 and 75 get their vaccines. So again, just to be clear about the messaging, not to, raise people's hopes that they're going to get it soon. If there could be a bit more clarity about the likely time when different age cohorts or different cohorts generally are likely to get it. And if those kind of forecasts could be provided, I think it would be helpful. Thanks, Minister.
And Hannah.
Thank you very much, Deputy, for the questions. So, in terms of the deliveries to date, they've now been published. So you'll be able to get them on your phone now or after the debate. And I have asked the department to provide regular updates. Personally, I think daily updates could lead to a lot of anxiety, because what you'll see then is on a single day you might get 80,000 might arrive in on a day. And if you just took that day, and there are some people who will use the information to try and undermine the programme, it would look like there'd be a huge gap. So let me just think through that. But I certainly agree that regular updates would be very useful. But can I ask for the cooperation of the House as well, if that's possible? Because when I gave the September figure, the first time the AstraZeneca figure changed and people were saying, oh, well, maybe we won't meet September, I was accused in here of over-promising. And I was accused outside of here of making false promises, which is essentially being accused of lying, when in fact all I was doing was providing exactly what everyone is very reasonably asking for in the context of the fact that these will change. So all I would ask, if possible, is the cooperation of colleagues in that, if that is possible. With respect to Moderna, my understanding is that those figures are not the figures. My understanding is that quite a lot of Moderna, that a more significant amount of than that has been given out, but let me just double check and I'll get you a detailed note on it. Yeah, okay. Let me take a look, because the last time I checked, the majority of Moderna had gone out. So we'll just look at that. In terms of April, absolutely, with a lot of focus on this. So we're going from, let's say, around 86,000 this week up to, hopefully, if the supplies come in, 250,000 in just 4 weeks' time.
Thank you, Minister.
Yeah, so the plan has been published, though, in terms of, we've got the 40 vaccination centres, the 37 and the 3 GP hubs, the pharmacies, the GP practices and so forth. But I'll get a more detailed note for colleagues on exactly that. And I'll revert to you in writing on the rest.
Next is the government slot. Deputy